Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2547. Thank you very much. Due to your overwhelming support, active participation, mentorship, and everything what you have given to this platform, really, I am your disciple, a student. As a host, I am enriching my knowledge due to your expertise. So, thank you very much for joining. Today, I would like to welcome Madam Kamini Dhimanji, former professor and HOD, All India Institute of Ayurveda, PTSR, from at present from Dubai. Welcome, Madam. And Professor Mamta Kumari Swain, Professor and HOD, Department of PTSR, Jeevan Jyoti Ayurved Medical College and Hospital, Lodha, Aligarh. Welcome, Mamta ji. Welcome. I am really grateful to you both that you both friends are together with your expertise, with your knowledge, with your authorship, everything. So thank you. With your support only, we have been able to reach this height in 5 years, and we have conducted 907 in recent 365 days. So thank you again. Thank you. I would like to communicate my regards to all my gurus, because I am disciple, I am a student of you. So thank you. And without wasting much time, I would like to communicate my regards to all our expert of the dais, Deepika ji, Bandana ji, Anjali ji, Sudha ji, Krishna Meher is also joined. Respected Vishnu Datt Agrawal ji has also joined. Welcome, sir. So, without wasting much time, I would like to request Kamini Dhimanji for his preamble, welcome, and inspiring motivation. Kamini ji.
जी नमस्कार पवन सर
Namaskar.
नमस्कार टू अग्रवाल सर welcome to all the experts whosoever joined over Vanda madam, Dr. Sudha, Dr. Anjali, Deepika, today's speaker Mamta. Dr. Mamta is, as sir told, she is my classmate and we have done PG both together from Jamnagar, and she has completed her service from Odisha. Now she is working at Aligarh College and guiding PG scholars also. And today's our topic is postnatal care. अगर हम देखें तो previously postnatal care was day to day practice of each and every home, and there was we can see that combined family system, so patients or females were not having an issue following the postnatal care. Nowadays what is happening now, a nuclear family system, females are not well aware or not able to take care during postnatal period. So in that case, we are there to help them and we are here to guide them. And for that, we should have each and every step, knowledge of each and every step, each and every day. And Ayurveda says that 24 up to 24 hours, Sutika Paricharya or care will be different. Up to 1 week, different. And up to 1.5 months, that is 45 days, specific care is mentioned in Ayurveda. So today we will discuss that postnatal care, along with that care at different places of India, what the people are following and what is the principle of Ayurveda behind that. That will be discussed in today's webinar. And Dr. Mamta is going to present her presentation. After that, we'll have expert opinion and then discussion upon that. Over to you, Dr. Mamta. You can share the screen. Dr. Mamta.
हाँ. Hello. Namaste, Pawan Sharma Bhaiji, and my dear friend Kamini, who is the dynamic leader of this webinar. And today you are giving me a chance to tell something regarding Sutika and its management. And thank to all who are joining in this webinar. What is Sutika? Sutika, really, it is a very vast chapter. So now I am telling regarding what is Sutika and how we will manage Sutika nowadays. So I can tell Sutika, a lady can be called Sutika only after the expulsion of the placenta. But in Ayurveda, it is a very nice term. And there is a proverb, God made mother because he could not be everywhere at the same time. There is emphasis to mother. This shows the importance of mother. It is said that of all the rights of women, the greatest is to be a mother. And Sutika is a very long period. So how will maintain? How will maintain? Kashyapa has given special importance to Sutika. Among Ashtanga Ayurveda, one part is Komarabhrutya. In Komarabhrutya, Kashyapa has given special importance in the management of the health of Sutika. Because Sutika, after the during the pregnancy period and after delivery, her body is empty. So she is too much weak. So he compared the puerperal woman with the house who has become very much old and which can be collapsed by heavy rain, earthquake, and heavy winds. Because that is her body is too much weak. So that may be coming to disease condition. So to prevent this condition of the puerperal woman, the body of her which has become weak due to development of the fetus and also empty body due to unsteadiness of all dhatus, labor pain, excretion of cledor, blood, etc. Her digestive power and muscle mass also decrease. Strength also decrease. So Kashyap described 64 Sutika diseases due to improper management during Sutika Kal. So we should keeping in mind the condition of the lady and to prevent the disease, 64 disease, we should provide proper regimen, diet and regimen by which she can revive her health, vigor, vitality as early as possible and reaches her pre-pregnancy stage. So what is puerperium? In Ayurveda, we can tell Sutika, so a lady can be called Sutika only after the expulsion of the placenta. Then what is the definition or what is puerperium? Puerperium is the period following childbirth which the body tissue, especially the pelvic organ, revert back approximately to the pre-pregnant state, both anatomically and physiologically. And if we see the duration of the puerperium, that is in modern science, they are telling approximately 6 weeks. And that is divided into 3 parts: immediate puerperium within 24 hours, early puerperium that is up to 7 days, and remote puerperium up to 6 weeks. But in Ayurveda, that is Susruta is also telling like modern science, that is puerperium is up to 1.5 months. Onena vidhina adhyardha masam upasaskrita, like that he is describing, that is 1.5 months. According to Bhava Prakash also, that duration of Sutika is also for 4 months. Because Bhava Prakash is also telling Bipotrapa Visuddhacha Vignya Balavarnini Urdhva Chaturbhya Masebhya Niyamam Pariharit. Up to 4 months we should restrict, or restriction should be there for the Sutika. And Susruta is telling Anena Vidhina Adhyardhama Samupasanskruta Vimukta Ahara Vihara Vigata Sutika Abhidhanasya. Sutika we can tell till 1.5 months. Again, punaha artavadarsana mityake till the menstrual cycle comes. According to Kasyapa, duration of Sutika Kal, that is up to 6 months. Duration of Sutika Kal up to 6 months. Why this type of a variation? Perhaps all you will tell why this type of a variation. Perhaps Kasyapa is telling 6 months, that is punaha artavadarsana mityake, because that is lactational amenorrhea. Kasyapa is telling dhatu paripurnata. Dhatu su paripurnesu sarira samavasthite. Means dhatu paripurna will occur till it will be take time taking, and body will come to one stage. Then only after 6 months, sanchita rudhira, whatever blood is situated in the yoni, that will come to outer side. It will take up to 6 months. So, so this is very, and Bhava Prakash is telling for us 4 months, maybe that is for a complicated delivery or any other thing. He wants to for 4 months rest till the Bala Barna will come. And Susruta is telling like modern 1.5 months. So that only duration, then involution of uterus. Involution of uterus, that is the occurring during Sutika Kal. We should give importance how the involution is occurring. Immediately following delivery, the uterus measures about 20 into 12 into 7.5 cm and weight about 1000 gram. At the end of 6 weeks, weight about 60 gram. That is the involution. When the process will be occurs, then uterus will be less and weight will be 60 gram. Then endometrium. How regeneration of the endometrium start from 7th day, and regeneration is completed by the day 16th, except at the placental site, it will be take up to 6 weeks. Cervix. Cervix contracts slowly. External os admit 2 finger for a few days. At the end of first week, it admit tip of the finger, only never revert back to the nulliparous state, whatever it may be. Then vagina takes 6 to 10 weeks to involute. It regain its tone, but never come to the virginal state. Broad ligament and round ligament also, it will take considerable time to recover from stretching and relaxation. Pelvic floor and pelvic fascia, it will also take long time to involute from the stretching effect during parturition. Then clinical assessment of involution. How will you assess whether involution is occurring or not? Following delivery, the fundus lies about 13.5 centimeter above the symphysis pubis, generally 5.5 inch. And during the first 24 hours, the level remain in that position. Thereafter, there is steady decrease in height by 1.25 centimeter or 0.5 inch in 24 hours, so that by the end of second week, that become the pelvic organ. Then lochia, it is the vaginal discharge for the first fortnight during puerperium. It has a peculiar odor. It has a peculiar offensive fishy smell. Its reaction is alkaline and become acid towards the end. Then color of Lucia. According to color of Lucia, also we can judge the purple lady or Sutika. First is Lucia rubra, red, 1 to 4 days. Then Lucia serosa, 5 to 9 days. The color is yellowish or pink or pale brownish. Then Lucia alba, white, 10 to 15 days. Then composition. Composition of Lucia. Lucia rubra consists generally blood, fetal membrane, decidua, vernix caseosa, lanugo, and meconium. Lucia serosa consists of less RBC, but more leukocyte, wound exudate, mucus from the cervix, and some microorganism, streptococci and staphylococci. Lucia alba contains generally plenty of decidual cell, leukocytes, mucus, fatty or granular epithelial cells, and some microorganism also. Then amount of Lucia, average amount of discharge for the first few days or 5 to 6 days is generally 250 ml. Normal duration may be extend up to 3 weeks. That duration of Lucia discharge that will be generally takes for 3 weeks. Then the clinical importance of Lucia. Why Lucia we will learn what is the importance for Sutika. I was telling that is the fishy odor, but if the odor is mal odor, bad odor, indicate infection or sometimes retained plug or cotton piece inside the vagina. Due to that may become bad smell, and that should be kept in your mind that indicate also infection. Then sometimes normal amount 250 ml generally estimated, but if it is scanty or absent, it is signify also infection or lochiometra. If it excessive, it also indicates some infection. Then persistent also red color beyond the normal limit signify also subinvolution or retained bits of conceptus. Then what are the general physiological changes in your body during that Sutika? If these changes are there, but I shall tell you that if that changes is there, then we will think that it is the normal. After delivery, pulse rate generally rise, but settle down on the second day. Temperature should not be above 99 degree Fahrenheit within 24 hours, then normal. Urinary tract bladder may be overdistended without any desire to pass urine. Then it will be normal. Gastrointestinal tract increased thirst in early puerperium is due to loss of fluid during labor, in lochia, perspiration, and constipation is due to delayed gastrointestinal motility. Due to gastrointestinal motility, perineal discomfort following delivery. So gastrointestinal tract we have to keep. If there is constipation, we can give mild laxative. Afterwards, I shall tell you Triphala water or something in the some lukewarm water, milk, etc. we can give, isabagul, etc. we can give. Then weight loss. 5 to 6 kg weight loss due to expulsion of the fetus, placenta, liquor, and blood loss. And sometimes blood value are little bit disturbed Decreased blood volume is due to blood loss following delivery and a return to normal in second week. RBC volume and hematocrit value return to normal also by second week. Sorry, by 80 week. Leukocytosis occurs following delivery due to the stress of labor. Platelet count decreases soon after the separation of the placenta, but rises within 4 to 10 days. Fibrinogen level remain high up to second week of puerperium. So a hypercoagulable state persists for 48 hours of postpartum. Then lactation. All you know that first 2 days following delivery, secretion of colostrum from the breast. It is a deep yellow serous fluid, alkaline in reaction. It contains high protein, vitamin A, potassium, fat, sodium, and less carbohydrate. And it has too much importance for Sutika, and that milk should give to the child because it contains immunoglobulin, IgGA, IgGG, IgM, lymphocyte, lactoferrin, and other enzyme. Also, then physiology of lactation. The physiological basis of lactation can be divided into 4 pages. Preparation of the breast, mammogenesis, that is the secretion from the breast alveoli, lactogenesis, ejection of the milk, galactokinesis, and how when maintenance of lactation, how child will suck and that galactopoiesis, maintenance of lactation will be occurs, continue through the suckling effect of the child, and that will be continue up to generally for 6 months and more. Then principle of management of how will you, which principle we have to manage in Sutika. Generally in Ayurveda we have to give importance how to pacify Vata dosha, promotes healing, Branaropana in Sutika, episiotomy wound, and restore health and nourishment, promote lactation, and prevent any complication. Prevent any complication means avoid infection, hemorrhage, depression, constipation, uterine prolapse, anything. In modern science also telling that principle of management to give all out attention to restore the health status of mother, to prevent infection, to take care of the breast, including promotion of lactation and nourishing of the child, to motivate the mother for contraceptive acceptance. Because if will not motivate, then again she will conceive and then her child will be suffer. So we have to teach them every method how she will be which method she easily accept, and that will be benefit for her and for her family, and lastly for the nation as a whole. So motivation of the mother for contraceptive acceptance. Then immediate attention after following delivery, what we have to do? Following delivery, the patient should be closely observed as outlined in the management of the 4th stage of the labor. We should observe whether that is bleeding or temperature, pulse, whatever it may be, we should observe. She may be given something to drink or something to eat if she is hungry. So this is the immediately we should give attention. Then rest and ambulance. Ambulance, all you know that not confined to bed, though rest is necessary physically and mentally. It is difficult to categorize and uniform specific period of rest for the Sutika or puerperal lady. According to the condition, it will be vary that the patient should take immediately following delivery. Reasonable period of Generally, 8 to 12-hour rest is enough for most of the patients. After a good resting period, she may become fresh and can breastfeed the baby and also moves out to go to the toilet freely. Nowadays, early ambulation is in favor because ambulation, if she will be not confined to bed, she will be moved. Early ambulation provides a sense of well-being, less bladder complication and constipation are reduced. And also that facilitates uterine drainage and create and also facilitate involution of the uterus and less peripheral venous thrombosis and embolic phenomenon. However, ambulation does not mean that she should do normal day-to-day activities very early, which should be restricted minimum for 6 weeks. During this period, she should take as much rest as possible and avoid strenuous work, especially lifting, pushing, straining, all these things. The patient generally is to spend sometimes some of the resting time in a prone position because that prone position promote anteversion of the uterus. And then diet, ahar, bihar, general mode of life, it is very essential for a Sutika. All you know, perhaps Charak, according to Charak, corporal woman when feels hunger, she should be prescribed with the powder of pipali mula chabya chitraka srungavera or panchakola with anyone out of Gruta Taila Bassa Majja, considering her tolerability. And the quantity really she can digest easily. That is the quantity she should take. After giving this, her abdomen also should be massaged and wrapped properly with a big clean cloth because this wrapping produce compression of the abdomen and avoid presence of hollow space. So Vayu does not get vitiated because due to excretion of blood, vigor, cletho, everything, her body is empty and vata vitiation is must. At that time, if vata vitiation, then we cannot provide her santarpana because she cannot digest. Apatarpana also we cannot give. So very nicely, wrapping should be produced and compression of the abdomen and avoid the presence of hollow space. But Susruta is telling, applying massage with Bala Taila, the corporal women should prescribe the decoction of Bhadra Daru drugs, which is also our Gana chapter, so many drugs are there, and that is also capable of suppressing Vata dosa. Generally, in our place or most of the place that we are giving Dasamula or Sutika Dasamula, afterwards I shall tell you. If sometimes the blood is still left inside of the uterus, if there is something inside, then powder of pipali moda, hasti pipali chitraka and srungavera with warm jaggery water should be given. It is very nice and very dramatically it will be work. Normally the women should be given with good irrigation with water and should avoid anger, heavy work and coitus. Because anger she should avoid and heavy work if will do, her body is empty. Anger, because in Ayurveda it is described that krodha soka abachalya striya stanyanaasa bhavati. So she should not do, and episiotomy wound is not well healed. So she should avoid also coitus and for also conception, should be avoided for some days. Then rice gruel generally prepared with the drug of Bidari Gandhadi group and mixed with milk and grutha. We can give for 3 days, our Shastra, according to Shastra, then for 7 days. Then cook sali rice with meat soup also of a wild animal, prepared with java, kola, kulatha, should be prescribed according to her strength and digestive power. Because slowly we will give jabagu, manda, khichdi, and that will be maintain also all these vitamins and digestive capacity will be increased slowly. So according to considering her strength and the digestive power, we should give in. Normally, the women should be given good irrigation with hot water and should avoid anger, exercise, and quotas. Generally, I was telling. Then, but Kashyap is telling the purpural woman should sit in a over a small chair covered with a leather. That bag filled with a hot bola taila. Bola taila, because with this, Joni become healthy and pain will be subside and Bata Samana will be there. And Sudesana in the Joni should be given with oil, Priyangu Taila, with it, in that we can give. After proper sedation, hot water bath followed by rest should be given. After overcoming the tiredness, when the tiredness will be go, then fumigation with the kudha, gogulu, agaru mixed with grutha should be given because that is anti-inflammatory, antibacterial property, anti-infective property, and that will create brana ropana, brana sodhana karma, and easily that will be healed. And also, Sutika dasamula pachana, 50 ml, twice a day, 30 to 50 ml, twice a day can be given during Sutika Kal. Because Sutika dasamul has very nice effect on Sutika. That is some from dasamul panch is there. Salaparni, Prusniparni, Bruhati Dvaya and Gokura and Dasti, Prasarani, Viswa, Guruchi, Mutha. All these is Sutika dasamul we can give. Then we'll, this is the diet and general mode of life. Then care of the urinary bladder. Generally, after delivery, there is atonicity of the bladder wall with elasticity of the abdominal muscle following delivery. So it necessitates extra attention to urinary bladder, especially in early puerperium. The patient is encouraged to pass urine 6 to 8 hours following delivery. Because in that, why? That is the episiotomy wound. So she can't, due to that only, there is the atonicity of the bladder wall and she cannot pass urine. So if still then, if she fails to pass urine, then she should maintain privacy or alteration in the position or allowing the patient sometimes to move and to go to the toilet for urination. And privacy should be maintained. If still fails to pass urine, then catheterization should be done. Then care of a bowel. The problem of constipation is much less because if the patient will be early ambulant and diet proper diet she will take, then there will be constipation is much less. But if necessary, mild laxative may be given at bedtimes. Triphala water may be given. Then care of the bowel, then sleep. Because sleep is very important for Sutika. Never we cannot manage to her. The patient in need of rest, both physical and mental. She should be protected against worries, undue fatigue, because I was telling that krodha soka abachallyat striya stanyanaasa bhavati. So she should not take tension. Then care of the vulva and episiotomy wound, how will it take? Removal of the, after removal of the placenta, the patient should be cleaned with hot water of Triphala or Panchakasaya. So vulva and buttock may not remain dirty. The perineal wound should be dressed with Jatyadi Taila after each act of micturition and defecation at least twice a day. Unless it is difficult to cure, according to Bhava Prakash, also Tumbi Patra and Lodhra should be applied, paste of Tumbi Patra and Lodhra should be applied at a vaginal orifice because due to antibacterial property, Kasaya property, that will be healed. Then care of the breast. It is very much essential from the during pregnancy we should take care because nipple there will be crust formation is there, though there will be milk formation, but still then milk will not come outside due to crust. So nipple should be washed with sterile water before each feeding. It should be clean and dried and kept covered by sterile linen after the feeding is over, because the child is very delicate, so we should take care of the breast. And from the antenatal period, we should do some exercise, how that nipple should not be depressed, nipple should not be cracked, like that. That should be proper come to outer side. Then only the child can breastfeed then only child can take milk. Then another thing is rooming in a plant. In this system, baby generally remain in the mother's bedside in a cot for a greater part, generally for 24 hours, because mother and baby are treated as an unit. It is the very nice for the lady. It will be give physical and psychological advance. Physical and psychological advantage to both mother and baby. It minimizes generally cross infection, which is more like when the baby are put together in nursery. It also make possible for the mother to take care of her child and to feed the baby on demand. Then we should maintain asepsis and antiseptic. That is the Rakhya Karma in Ayurveda. Asepsis generally must be maintained, especially during the first week of puerperium, because episiotomy wound are raw and that a child umbilicus is not proper healed. So uterus provides also bleeding and lochia discharge is there. So uterus provides an ideal environment for the growth of the organism. The devitalized lacerated tissue of the lower genital tract are unable to prevent infection because blood is very, very good media to take infection from exterior to interior. So, and also the capping vaginal introitus facilitates entry of the organism. The general resistance is also low during childbirth process. So, liberal use of local antiseptic, aseptic measure during perineal wound dressing and use of clean bed linen and clothing should be proper. And if will not do, then mother and child will be suffer. And also to keep the room dust free and restriction of visitors to minimum, because if they will handle the child and go frequently, then infection will be there, exogenous infection will be there. So keep the room dust free and restriction of the visitors minimum. Help also reduce the exogenous infection. And around the dwelling place of the puerperal woman, the child, the twig of Adani, Khadira, Karkandu, Pilu, Parusaka should be, Nimba should be hanged, and Sarsapa, Tandula, Otasi should be strewn in the floor. That is also antibacterial, antifungal, and a anti-infective capacity, and that will be Rakhyagna Guna, so that will be there. Then we should advise the lady some postpartum exercise, because postpartum exercise generally improve the muscle tone, which are stretched during pregnancy and labor, especially abdominal and perineal muscles. To educate the mother about the correct posture to be attained when the patient is getting up from her bed. Never episiotomy stitch should be open, or abdominal, if anything, or any tear that will be create harm to the mother. So we should do advise her for postpartum exercise, and rule and regulation we should advise. Then advantage, what are the advantage occurs by the exercise? Because it by exercise it minimize the peripheral venous thrombosis by promoting arterial circulation and preventing venous stasis, and to prevent also backache. So many mother always complain there will be backache. So if we'll do all these things, then backache will be not there, and it also prevent genital prolapse and stress incontinence of urine. And how the exercise will be done, because first to tone up the number of, we should remove the backache and tone up the pelvic floor muscle. When we will tone up the pelvic floor muscle, the patient is asked to contract the pelvic muscle in a manner to withhold the act of defecation or urination, and then to relax. This exercise is very important, not only Sutika, but also for aging process, or to prevent prolapse, or if without Sutika also there is prolapse, then this exercise is too much important. So the patient is asked to contact the pelvic muscle, and that as such the withhold the act of defecation or urination, then slowly to relax. This will be repeated at least for 3 months. And as often as possible, this exercise can be done. Then number 2, to tone up the back muscle, because backache is there. The patient lie on her face with the arm by her side. The head and shoulder are slowly moved up and down. The procedure is to be repeated 3 to 4 times a day, and gradually increase each day. So backache will be not there. Then this is the procedure of exercise. Then avoidance of intercourse. I was telling that because episiotomy wound is not well healed, so avoidance of intercourse generally for a reasonable of 2 to 3 weeks or more, until laceration of episiotomy wound, or until the laceration are well healed or episiotomy wound are well healed. Because till the menstruation come, and she should take some contraceptive measure. So this is the thing. Then family planning advice and guidance. This is helpful in preventing family planning advice, accidental pregnancy. Non-lactating mothers should practice some form of contraceptive measure, because lactational amenorrhea is not there for her. Those who are not giving breastfeeding, the poor uneducated person are generally have no knowledge regarding the contraceptive, condom, jelly, and copper tea, etc. for preventing pregnancy. So we should teach them some method which they can follow. I was telling previously, because small family norm not only beneficial for her family but also the nation as a whole. So if precaution will not taken, then mother as well as the infant both will suffer the consequence. Then management of a minor ailment due to labor pain, due to labor pain, loss of cledor, blood, vitiation of a bath is there. So general immunity and strength is also decreased, and therefore management of bath balance and a body strength of Sutika how to be increased. We should give emphasis. Then due to expulsion of the fetus, loss of fluid, blood, and during labor there will be exhaustion. All these causes dhatu khaya. So dhatu khaya causes loss of body immunity. During that period, even a minor ailment also occurs, can cause a lot of harm to the body. So sometimes Makalasulo will be there. Then it is all infrequent spasmodic pain felt in the lower abdomen after delivery. Presence of a blood clot or beats after birth lead to hypotonic contraction of the uterus. How to expel the blood out? Then Makalasulo is Sulo Pradhan Vyadhi occurring during Sutika Avastha. It is also listed among the Sutika Roga, but it is generally occurring. It is the denote pain reduced due to pain is occurring due to Vata and Sonita. So cause is due to vitiated Vata and Sonita. Aggravated Vata manifest in the form of Sula in a different part of the body. Dusita Rakta, if not excreted properly also, that causes retention and create pain. And then Lakshana of the Sutika, Lakshana of Makal, there is a retained Rakta attends in the form of a Granthi, a knot-like structure in the region of Adhonabi, Basti, Parso, like that. Sula pain is occur in the Nabhi, Basti, Hrudaya, Sira, Koshta, etc. is described, and that pain is very pricking type of a pain, and a spitting type of pain, and a cutting type of a pain is occurring. So vitiated Vata not only retain the Dushta Rakta, but also the Mutra Mala causing Adhmana and Mutra Sangha, and a contribute pain in a particular site generally. So treatment, all I am not telling detail. Decoction of Barunadi group of drugs mixed with the Panchakola and Ela. Then Trikatu, Chaturjata, Trijata also mixed with the old Jaggery we can give. And also, according to condition and situation of the patient, we can give pure Hingu, very small quantity like Masa with Gruta, cures Makal Sula. Devadarbhyadi Kwath also we can give, Sutika Dasamula Kwath we can give, that will give satisfactory result. Sutika Dasamul Kwath contain Laghu Panchamula, Sahachara, Prasarani, Guduchi, Mutha, and all because Sutika Dasamula is very nice. Laghu Panchamula has Bata Kapha Samaka and Bruhana Balya property. In Sutika there is Bata Prakapo and Dhatu Kshaya, which leads to Dosa Vaisyama and Dorbalya. So Laghu Panchamula may give in to pacify Vata Dosa, enhance also Dhatu Bosana, and improves physical strength of Sutika. Mutrala effect of Gokhura is also create normal diuresis during puerperium, normalizes the frequency of micturition, and helps in getting sensation of urge of micturition. So it is believed that it can be used for kidney, bladder, urinary tract, and urogenital related condition also we can give. Early evacuation decrease the chance of atonicity of uterus, constipation. So it will also help to for the involution of the uterus. And the antioxidant property of Dusika Dasamul may improve the mental stress and other inflammatory disease. Immunomodulatory property of Amruta or Guduchi, all due to Dhatu Khaya, Sutika gets prone to many infection because of low immunity. Guduchi is a rasayan helps improve the immune system by enhancing dosha, dhatu samyata, and dhatu posan. Sunthi, also due to Dipan Pachan and Batahar property, may facilitate dhatu posan. Sunthi is a well-known drug which is generally supplemented to Sutika to cope up the puerperal disorder. Sabhage Sunthi Khanda Modaka we can give. Mustaka is also anti-inflammatory, mutha, analgesic, antipyretic, antidiarrheal, anti-arthritic, anti-convulsing, tranquilizing, and antibacterial property. Mutha. It can also help for the physiological, it can improve the status of Sutika. Musta is also Dipan drug, Dipan Pachan, that will be drug. Then really we can give some drugs in Ayurveda. Lastly, I am telling some drug we can give single dahar for the treatment also. Satavari we can give, that is Rasayana, Vatapita Samaka, Stanya Janan. That is also galactagogue due to satabarin and saponin may stimulate prolactin secretion or mammary duct proliferation. That will be satavari will be caused. Satavari is Stanyajanan, it is the very all you know, it has immunomodulator action, enhanced macrophage activity, antibody production, and tissue healing, stimulate collagen synthesis and epithelialization. So always we should promote Satavari because it also create involution of uterus. Ashwagandha also single herb we can give, that will reduce cortisol, modulate stress response. It is also anxiolytic, antidepressant, ashwagandha, and anti-inflammatory, antioxidant, give energy and muscle to the muscle strength for the Sutika. Immunomodulator action, it acts as also a sedative. Boda also we can give according to the condition and the situation of the patient. It is Batasamaka, Balya, Bruhana, Brusya, Vedana Sthapan. Jira also we can give, it is Dipan Pachan, Anubatanuloman, Stanya Sodhan, digestive stimulant, carminative, reduce intestinal gas and bloating. It is also galactagogue. It stimulates milk flow, and it has also Jira microbial action, essential oil that essential oil of Jira act against gut pathogens. Haridra is also sometimes we are using for Rakta Sodhana, Sothahara, Branaropana, anti-inflammatory, antioxidant, wound healing, stimulate the collagen synthesis, antimicrobial action, and uterine tonic because it promotes contraction and create involution of the uterus. Then other drug we are using, that is Dasamula Dasamula Quatho, Devadarbadi Quatho, Dasamula is also very nice. We will see that it will be act as in anti-inflammatory and Batasamak, Sothahara, Vedanasthapan, and analgesic because COX, cyclooxygenase, and lipoxygenase pathway are two major enzymatic route involved in the metabolism of arachidonic acid, a fatty acid found in the cell membrane, and these pathway produce that the play a role for the anti-inflammation and property. So Dasamula we can give. Dasamula act as uterine tonic, immunomodulator, adaptogenic also, reduce stress marker, and Dasamula is also respiratory benefit also give because there is Kantakari is there, bronchodilator effect is there. Then Satavari Kalpa, I was just telling Satavari, it is also like Sanyajanana, Bruhana, Vatapita Sama, Rasayana. It is galactagogue, nutritive, provides calorie and iron and calcium also. Anti-stress and adaptogenic property, tissue repair property. Then Lodrasava also we can give. It is uterine astringent, has reduce causes vasoconstriction, anti-inflammatory, antimicrobial property, and inhibit also pathogens. Then girocardiarist also, Dipan Pachan, Batalunovan, Sanyasodhan, digestive stimulant, galactagogue property also. It has galactagogue property, mild anti-inflammatory and antioxidant also. And other drug also we are using, that is Devodarpadikvatha. Sometimes there will be swelling. Devodarpadikvatha contain Devodaru, Guduchi, Sunti. It is also act on fever, arthritis, gout, all these things. Immunomodulatory action of the Guduchi is all know. Then sometimes Sahacharadi Kwatho we are giving, because that is a neuroprotective, and that create that may enhance the nerve growth factor and myelin repair, muscle relaxant. So sometimes Sahacharadi Kwatho, according to condition and the situation of the patient, we are giving Amrutadi Kwatho. If mild in fever or infection is there, then we are giving Amrutadi Kwatho, that is antiviral, antibacterial property and immunomodulatory action. Sutikari rasa, there is Lokho Bhasma and Swarna Bhasma is there. So this is also used in postpartum anemia, because the hematinic property is there. Lohovasma, Swarnavasma, bioavailable iron stimulate the erythropoietin synthesis, and it is act as a uterine tonic, may enhance oxytocin receptor sensitivity. So Sutikari rasa is also nice. Saubhagya Sunthi Kanta. It is also used female reproductive health, hormonal imbalance, that create hormonal balance, that is antispasmodic action, reducing uterine cramp. Generally, it is anti-inflammatory, immunomodulator, hormonal regulation. All these actions are there. Then other drug also, Sutika Hororosa. Sutika Hororosa, Suddha Hingula is there. Tricotu Tripholak. Tricotu generally enhance the acetylcholine release in the gut, improving motility. It is also used for postpartum complication, anti-inflammatory action, antibacterial action, and Panchajiraka Guda, another drug also we are using in for postpartum lactation and for digestive health. Also, Panchajiraka Guda stimulate the prolactin secretion. Jirokadi Modaka, Jira, Pipoli, Madhu, Ghruta. It is used for postpartum nutrition, digestion, and immunity. Jirokadhyarishta also, Jira, Mutha, Draksha, Dhataki Phulo is there. It is also used for generally postpartum weakness, and it is also act as a digestive tonic. Dhatakyadi Toilology also for perineal wound healing, because Dhataki is anti-inflammatory and repair the perineal wound. And another thing, that is that will be growth of blood vessel from the existing vasculature occurs throughout the life, that is angiogenesis occurs due to Dhataki Taila. So it has also antibacterial effect. Then Pathya of Pathya of Sutika.
Hariom.
Sutika should have a bath, much quantity of water. Boiled water should be taken for drinking purpose. And she should be Snehana and Swedana must be done every day as Desa and Kala. Maharishi Kasyapa has given special indication for Manda for Sutika. Then Apathya, sexual intercourse, physical, mental stress, anger, and there is contraindication of panchakarma for Sutika, and Nasya karma is also contraindicated. Then benefit of Sutika Parichadya. Proper Sutika Parichadya causes complete involution of the uterus and other pelvic organs so that they should come to their pre-pregnancy stage, maintain maternal and infant health, preventing any complication, and to establish infant feeding. And lastly, I was just telling that conclusion, as Sutika is a critical period for women, it needs proper management and care with a specific diet, mode of life, and aushadhi. In Sutika Kal, there is vitiation of Vata, therefore, it is advisable to take Vata Samak drugs. Vata Samak Abhyanga also must play most significant role to specify Vata dosa. Sutika Paricharya, most of the drug have been prescribed single drug or a compound drug, but in Ayurvedic treatment, which will improve her physiological condition, also protect her, prevent her diseases. Thank you to all. As such, it is a skeleton upon which the place of more detailed clinical and theoretical knowledge can grow. Thanks to all for patience hearing. Thank you.
एक्सीलेंट ममता जी। अभी तक कहाँ थे 5 साल से? अरे जुड़ते रहिएगा भाई, जुड़ते रहिएगा। बहुत शानदार, बहुत शानदार। कामिनी जी, आदरणीय कामिनी जी।
जी बहुत बढ़िया डॉक्टर ममता. You now stop sharing so we can see you in full screen. Yeah. Now session is open for discussion. Really presentation was very good. Very nicely you have covered all the topics from duration of the Sutika till the complications and till the Pathya. Everything you have covered in very short duration. Very nice presentation. Today we are having lot many experts also. We can have their opinion also and we can have some questions if anybody want to ask. तो सबसे पहले मैं बुलाना चाहूंगी डॉक्टर अंजुना मैडम, अगर सुन पा रही हैं तो. अंजुना मैडम. डॉक्टर वंदना मैडम.
मैम बहुत ही अच्छा प्रेजेंटेशन था और बहुत बारीकी से सारी मैम ने टिश्यू रिपेयर और उसके बाद गैलेक्टॉक्स जितने थे एंटीसेप्टिक के बहुत अच्छे से उन्होंने बताया. साथ ही पथ्य और जो यूजुअली डिलीवरी के बाद एकदम किस तरीके से अपने उस पे आना है डाइट पर, बहुत छोटी छोटी चीज़ें उन्होंने बताई. और अलग अलग जो मेडिकेशंस थे उनके क्या क्या वो किस तरीके से काम कर रहे हैं, तो बिगिनर्स के लिए भी बहुत अच्छा था कि हर एक का उन्होंने डिटेल में बताया कि अगर अमृतारिष्ट देना है तो कब देना है, सचराधिक्वाथ देना है तो कब देना है, देवदार्याधिक्वाथ देना है तो कब देना है. तो थैंक यू मैम, बहुत अच्छा प्रेजेंटेशन था. थैंक यू सो मच. थैंक यू कामिनी मैम एंड पवन सर.
डॉक्टर ममता, बाकी लोग पूछने से पहले मुझे थोड़ा सा एक दो डाउट था कि जैसे आयुर्वेद इज मेंशन दैट देश अनुसार, काल अनुसार, जाति अनुसार वी हैव टू टेक केयर ऑफ सुतिका. देश प्रसक्ता, जाति प्रसक्ता, कुल प्रसक्ता, 3 types of Sutika Paricharya should be followed. And in India we are having lot many different geographical variation. So, what have you seen in your area? The different type of any Sutika Paricharya or any modification, and somewhere in north, somewhere in east, west, whether any difference in following Sutika
Yes.
Paricharya, or we can advise something different to those people
Mm.
of different places. Yeah.
Generally, Jangala, Anupa, and a Sadharana Desa, 3 days are there. But what is happening? Sadharana Desa, normal type of, and Jangala and Anupa, we should give easily digestible. Jangala, normally oily or that type of. But Sutika is very prone, and it is very nice to give according to desa, according to place. In Odisha, we are giving that double boiled rice with jeera prominent, and we are giving easily digestible substance, but ghee we are giving less quantity. But I have seen during my study period in Gujarat, they are giving much quantity of ghee. What how if they will take, and that will come to drop and drop, because they are not taking non-veg, they are depend upon the ghee, so that is also easily digestible for them. So according to the place, condition, and situation of the patient, and we should prescribe that type of diet what she can easily digest. Jo desa kalo, but still then some laddu in some state like Pachima Banga or Calcutta side, they are giving some laddu prepared with rich protein, मैंने काजू किशमिश और जो मेवा, all these things, makhan, they will prepare. They are thinking if that laddu will take, then her strength will become earlier. But in our place, we are thinking if you will give more heavy food, then Sutika Atisar will be there. So we are not giving during that period non-veg, nothing you will not giving. We are giving lasun, slowly add lasun, because that is antibacterial property, and that will be anti-inflammatory, and that all the raw organ involved, that whatever the placental site, everything that will be easily healed up. So, and generally we are giving sunthi. After every diet, we are giving sunthi with slight ghee. So it will be differ from person to person. So if they are giving, they can digest heavy, then they can take. Never it will be occurs as Sutika Atisar. Sutika Atisar, it is very difficult to control because her body is weak. At that time, of Santarpana Chikitsa we cannot give, and Apatarpana Chikitsa also we cannot give. We should give that type of diet which can easily digestible, and according to her Bala Agni, then that type of diet if you will give, then it will be beneficial for Sutika.
Yeah, very nice, very nice. One thing you have added lasun. Lasun is a, yeah, having this anti, we can say the hyperlipidemic effect. So, lot many research,
Add, because that
research.
everything will be reduced due to lasun and sunthi.
Mm-hmm.
But sunthi fastly, within 1-2 days we are adding sunthi. Then only afterwards, after 1 week, we will add slowly lasun and ghee.
Okay,
And
nice,
मैम
ghee.
nice,
एक बात और है
nice.
मैम,
And
जैसे नॉर्थ
hmm,
में मैम वीट को ग्रेजुअली मूव के बाद फिर वीट के ऊपर आते हैं। साउथ में मोस्टली राइस को यूज करते हैं, वो भले ही बॉइल्ड राइस यूज करते हैं कहीं कहीं किसी में। इसके ऊपर भी मैम कुछ बताइए, क्योंकि
Yeah.
नॉर्थ इंडिया में जब हम लोग पोस्टनेटल राइस को अवॉइड ही करते हैं, तो उसके ऊपर भी मैम कुछ बताइए प्लीज।
क्या
जैसे
राइस
नॉर्थ इंडिया में मैम गोधूम को इंट्रोड्यूस करते हैं, जब वो लाजा ये मंड
madam,
पे या
raja
लेटी
is
करते
easily
हैं।
digestible. So
नहीं नहीं,
whatever.
मंड नहीं मैम, लाजा इज डिफरेंट। आई एम टॉकिंग अबाउट wheat and rice.
Wheat and madam, wheat, if it is not generally wheat, if you will give, then first we have to with liquid, with hot water, we have to add wheat. Then
दलिया,
only
दलिया in
soft.
form of dalia. Yes.
Then it will be soft. Then we will do chapati and we will give. Never,
Yes, yes.
will not digest easily. But rice, we are double boiled rice. Once boil, again another boiled rice, if you will give, then that will be act like jabagu, manda, peya, bilepi, that will be act slowly and improving her capacity easily. But
Dr. Mamta, one thing, one more query that you are telling about ghee. So nowadays, people are having in fashion that don't consume ghee.
no,
So in
what is,
that case, yeah.
uh,
Hmm.
tell me. Ghee generally, what will be happen? That will be because everything only, not in any sabji or thing, direct ghee with rice or with जो puff और क्या बोलते हैं वो जो puffed rice, in
Hmm.
that we are adding ghee, not ghee with any curry or that. Raw ghee we can give, and sunthi, because it is Saubhagya Sunthi Khand also, there is ghee is there. But here we are giving plain sunthi with ghee. And that will be, what will be happen? That will be clean the passage, and that will be give analgesic effect, and that will be also Agni Dipan काम करेगी. So due to that only we are giving some amount of ghee, not much quantity ghee. But in Gujarat side, they are giving more quantity ghee. I have seen. But in Orissa, we are giving less quantity ghee slowly. But sometimes you have seen after delivery also, after 2 to 3 hour normal delivery, they are so much hungry. We have to give some diet, some tiffin or something what she wants to eat. So in that case, we are adding sunthi and ghee in our place to every diet to increase the digestive power, because due to excretion of clay, the blood, vigor, vitality, everything is lost and digestive capacity is less. So to enhance the capacity, sunthi and ghee will be Agni Dipan वो काम करेगी, और sunthi Dipan Pachan Gun with ghee if you will give, then digestive fire will increase, not much quantity. If you will give much quantity, then diarrhea will be there. She can't digest.
Yeah, but nowadays females are very conscious and they are not ready to take ghee.
Only
That
during
is the thing.
Sutaka, during देखो
Hmm.
pure ghee, not other thing. Pure ghee, it is very nice. If you will add any curry, it has other effect. If you will only obese person also, nowadays research is there. Obese person can take 2 teaspoons of ghee on an empty stomach, not with any rice, anything, and with dalchini powder, that cinnamon powder they will take. Then only also their fat is also in decrease. They are advising somewhere that is Agni Dipan Chikitsa. And if you obese person and cinnamon also we will give, that will be also have effect for insulin resistance. And in PCOD everything there is cinnamon also act very nicely. Ghee is not nobody during Sutika period, not afterwards. Afterwards, if will take and will sit and do work, homework or doctor profession, then fat will be increased. But during Sutika Kal, she is so lean and thin, everything is empty, and to increase her digestive fire, we can add ghee and sunti at a time with any diet during the Sutika Kal. And
Yes.
it will be analgesic effect, Vata Samaka property, and strength will be increased, digestive capacity will be increased. But not that type of more quantity, only teaspoonful ghee, pure ghee, not in any vegetable, curry, but pure ghee, single we can give. That will never increase fat.
Okay. Deepika, do you want to ask anything? Deepika? नहीं है क्वेश्चन दीपिका का. चलो रामवीर सर, आपका एक्सपर्ट ओपिनियन. उसके
आदरणीय
बिना तो
रामवीर भाई
वेबिनार,
जी,
हाँ उसके बिना तो मैं वही बोली, रामवीर सर आप आ जाइए, आपके एक्सपर्ट ओपिनियन के बिना तो वेबिनार कंप्लीट ही नहीं होता हमारा.
ऐसा नहीं है मैम। थैंक यू, थैंक यू मैम। ममता जी को बहुत बहुत बधाई। अच्छा प्रेजेंटेशन दिया, बड़ी अच्छी चर्चा होती है हम लोगों की। मुझे लगता है मैं कई सेमिनार वेबिनार अटेंड करता हूँ पवन जी के कृपा से, पवन जी के सानिध्य में। मगर इस तरह की चर्चा होती है तो बड़ा अच्छा लगता है कि मेरा डिपार्टमेंट का जो जो अपने हम लोग कार्यक्रम करते हैं उसमें चर्चा होती है तो बड़ा ही बहुत ही अच्छा लगता है, आनंद आता है। बहुत ही अच्छी तरह से प्रेजेंट किया मैम ने। वंदना जी प्रणाम। एक महीने का ही क्यों, माँ से व्यय परिहरारित, वही भाव प्रकाश माँ से व्यय कहता है, वही भाव प्रकाश 4 महीने का ही कहता है, वही 1.5 महीने का सुश्रुत कहता है, और अपने काश्यप वहाँ पे 6 महीने का कह देते हैं, चरक वहाँ पे 1.5 महीने का कह देते हैं, और कुछ लोग तो कहते हैं पुनरार्थ दर्शन। तो निश्चित ही अपने जो धातुएं हैं, कौन सी धातु कितने दिन में बनती है, ये आचार्य पहले ही बता के गए। तो पूरे शरीर के अंदर जो धातुएं हैं उनके अंदर परिवर्तन आता है। तो एंड्रोमीटियम की अपने जो एपिथेलाइजेशन होता है यूट्रस का, वो जल्दी हो जाता है। एपिथेलाइजेशन के बाद में जो अपने मस्कुलेचर आता है, मस्कुलर लेयर आती है, अपने मायोमीट्रियम आती है, उसके अंदर इन्वोल्यूशन जो होता है वो उसमें टाइम लगता है। फिर उसके लिगामेंट्स हैं, लिगामेंट्स जितनी सॉफ्ट धातु होगी उतनी जल्दी उसके अंदर रिपेयरिंग होगी और अपने पुनः अपनी अवस्था में आएगी जो प्री प्रेगनेंसी में थी वो। और जितनी ज्यादा हार्ड धातुएं होंगी उतना देर से होगा। तो जो लिगामेंट्स हैं, राउंड लिगामेंट्स हैं, बाकी के फेसिया है, पेल्विक फेसिया है, ये सारी और देर में आती है। तो इसलिए अलग अलग आचार्यों ने अलग अलग तरीके से, और अपनी जो वो कहते हैं अपने उसमें षडवी मास भी धातु रुद्रादय, 6 महीने के बाद में सभी धातुएं नॉर्मल आ जाती है, इसलिए 6 महीने तक उन्होंने काश्यप ने लिखा। बाकी की धातु रस धातु है, जैसे एपिथेलाइजेशन है, रस धातु जल्दी बन जाती है, तो एपिथेलाइजेशन जल्दी हो जाता है। और एपिथेलाइजेशन होने के बाद में ही लोकिया खत्म होता है। लोकिया रबरा, लोकिया सिरोसा और लोकिया एल्बा। तो लोकिया रबरा विद इन 3 डेज खत्म हो जाता है। इसका मतलब एपिथेलाइजेशन हो गया। एपिथेलाइजेशन जब तक नहीं होगा तब तक लोकिया रबरा चलता ही रहेगा, उसके अंदर ब्लड आता ही रहेगा। तो इसलिए इन्होंने हमारे आचार्य ने कहा है, क्या जबरदस्त बात कही है। हमारा आचार्य कहता है कि जो हम लोग देते हैं, क्या देते हैं, सूतकाम खलु वृक्षता विदित्वा स्नेहम पायत परम सत्य। अभी जस्ट बात मैम कर रही थी कि उसको कितनी, अब आचार्य ने ये नहीं कहा आप 50 ml दे दीजिए, 100 ml दे दीजिए, जितनी उसकी इच्छा है इतना वो ले सकती है। परम सत्या यानी जिसकी इच्छा के अनुसार ही ले पाएगी। मात्रा पुनर्ग्नि बलापेक्षणी, तो उस मात्रा के अनुसार जितना वो ले सकती है उतना देना है। अकेला घी नहीं देना है। अब इसका देखिए साइंटिफिक क्या वो है, अकेला घी नहीं देना है, बसा मज्जा जो भी उसके अंदर अपने उसको अनुकूल है उसको दे सकते हैं। मगर उसके साथ में क्या देना है, पिपली, पिपली मूर, चब्द, चित्रक, संगवेर, 5 पंचकोल दिया है। क्यों दिया है पंचकोल? अब अपने जानते हैं कि जैसे ही डिलीवरी होती है, अभी मैंने बताया कॉन्स्टिपेशन इज अ कॉम्प्लिकेशन ऑफ द परपुरियम। अब क्यों होता है कि तो उसकी पेरिस्टल्टिक मूवमेंट है, स्लो रहती हैं, और जो मसल्स उसकी होती है, इंटेस्टाइन की जो मसल्स होती हैं, जिसको अपने फाइबर्स होते हैं, मसल फाइबर्स, वो भी रिलैक्स रहते हैं। तो उसकी कॉन्स्टिपेशन का कारण रहता है, आत्मान उसका कारण बनता है। तो उसके लिए जब पिपली, पिपली मूल, चब्बे चित्र के नागर जब देते हैं तो उसकी तीक्ष्णता होती है, और ज्यादा तीक्ष्ण दे दिया तो वो तीक्ष्णता को कम करने के लिए घृत देते हैं। और घृत के देने के परिणाम स्वरूप क्या आता है, अपने इंटेस्टाइन के अंदर पेरिस्टल्टिक मूवमेंट को वो स्टिमुलेट करती है। और पेरिस्टल्टिक मूवमेंट स्टिमुलेट करती है तो उससे उसको अपनी अग्नि कह दीजिए, चाहे उसको वायु को सामन कर दीजिए, तो उससे कॉन्स्टिपेशन नहीं होता है। अब इसको देने के बाद फिर क्या करना है, फिर उन्होंने वही चीज कह दी कि जब ये पक जाए, पच जाए, तो उसके बाद में उसको देना है अपने स्नेह पान के बाद में यवागु देना है। हम लोग जानते हैं कि जब एक्सॉर्शन होता है डिलीवरी के समय में, तो वाटर कंटेंट्स बहुत ज्यादा लूज होते हैं, और वाटर कंटेंट्स लूज होते हैं तो उसको डायरेक्ट उसको खाना नहीं देना, उसको यवागु देनी है, यानी पानी की मात्रा अधिक देनी। अभी हमने जस्ट बताया कि पानी की अधिक मात्रा देने का परिणाम ये रहता है कि वो जल्दी पाच हो जाता है, सुपाच्य हो जाता है। जितनी पानी की मात्रा ज्यादा होती है तो उसका पाक करते हैं ज्यादा पानी में, तो उसका ज्यादा सुपाच्य हो जाता है, इसलिए अग्नि को वर्धन होता है। तो आचार्य ने हर चीज लिखी, 3 दिन के लिए कहा है, 5 दिन के लिए कहा है। अभी बात होती है मक्कल सूल की। मक्कल झूल की चिकित्सा सुश्रुत स्वयं कह रहे हैं, सुश्रुत कह रहे हैं सशेष दोष के लिए, दोष को हरण करने के लिए, ये दोष बचे हुए हैं उनके लिए क्या करना है। तो उन्होंने कहा है वही पिपली पिपली चित्र के चूर्ण सहितम उदरवेष्टनम, और ये अपने करने के बाद में उन्होंने गुणोदक के साथ में सशेष दोषाणाम, ये मक्कल झूल क्यों होता है, सशेष दोष की वजह से। सशेष दोष क्या है, पार्टिकल कोई भी रह गए हैं, चाहे क्लॉट रह गया हो ब्लड का, चाहे कोई पार्टिकल यूट्रस के अंदर रह गया तो उसके अंदर आफ्टर पेन कहते हैं। तो उसके लिए आचार्य पहले ही कह गया है सशेष दोषाणाम तुवतः पिपली पिपलीमूढ़ हस्त पिपली चित्र संगवेर चूर्ण गुड़ोदकेन, गुड़ के उदक के साथ में दें। हमारे उत्तर भारत में एक हीरा बना के देते हैं महिलाओं को, जिससे सशेष दोष न रहे, उसमें गुड़ डालते हैं, अजवान डालते हैं, जीरा डालते हैं और जाने क्या क्या डालते हैं, मुझे इतना याद नहीं है, गाँव के अंदर खूब डालते हैं, खूब देते हैं। तो गुड़ोदक के साथ देना है। तो जो बक्कल सूल है उसकी चिकित्सा यही बता दी, दोष सशेष दोष को उसको दे देना। फिर उसमें आचार्य सुश्रुत तो इतने बढ़िया बात करता है कि उसके बाद में क्या करना है, उसके बाद क्या करना है, उसके बाद क्या करना है, क्रम से बता दिया उन्होंने कि उसके बाद में उसको उधर का अपने को मसाज करनी है। इन्वोल्यूशन, यूट्रस के इन्वोल्यूशन के लिए जहाँ पीपीएच हम लोग पढ़ते हैं वहाँ अपने एब्डोमिनल मसाज के लिए लिखा गया है। तो एब्डोमिनल मसाज का मतलब वही अभ्यंग, एब्डोमिन का करना है, एड़ी का पैर का नहीं करना है, जहाँ जिस अंग का करना है उसी अंग के लिए कहा गया। तो अभ्यंग कहाँ करना है, सर्वांग बाद में, पहले यूट्रस के जिससे इन्वोल्यूशन हो। उसके बाद क्या करना है, उसको अपने उदर वेष्टन करना है जिससे अपने वायु न रहे, जैसा बताया पट्ट के द्वारा। एक चीज और बताइए, चाहे सकने आगे चल के बात की, बहुत जबरदस्त। तो उन्होंने कहा है अपने जो चर्मबद्ध मासंधि, चमड़ी का एक टब बनाए, उसमें टब में बला तेल भरे, और बला तेल कैसा, उष्ण भरे, उसमें उसको सीट्स बांध दें। तो वेजाइनल जो अपने कोई भी अगर थोड़ा सा रेस्ट्रिक्शन वगैरह है वेजाइनल, तो उसके लिए ये अपने योनिम, उसको योनि प्रसीदति, इससे योनि प्रसीदन होता है। तो इसी तरह से रक्षा विधान का है, हमने अभी जस्ट बात की थी, रक्षा विधान कितना जबरदस्त का है। अपने जो है सरसों, पुष्ट, लांगली, कणकड़िका, कड़िका, सरसप और इनका चूर्ण वो है, वहाँ पे अब चूर्ण नहीं करें, जिससे चारों तरफ अपने वातावरण है वहाँ पे बैक्टीरियल नहीं होगा, मक्खियाँ नहीं आई। और दूसरे उन्होंने कहा रक्षा विधान। तो रक्षा विधान निम्न परूषक बदर शाखा भी से न परबीजिए, तो इनके द्वारा निम्न परूषक शाखा के द्वारा इनका परिवीजन करना चाहिए। शाखा के अंदर उसमें आता है रक्षोज्ञानी। सबसे पहले कह दिया उन्होंने कि इसके अंदर रक्षोज्ञान का प्रयोग करें। रक्षोज्ञान यानी जो भी व्रणी की चिकित्सा की जाती है वो सारी चिकित्सा यहाँ पे करनी है, उतना प्रिकॉशन रखना। यानी गर्भिणी प्रसूता को गर्भावस्था के बाद में जो इंजुरीज होती है वेजना के द्वारा, या वेजाइनल डिफेंस खत्म होता है तो इन्फेक्शन के चांसेस ज्यादा रहते हैं, इसलिए रक्षोज्ञान का प्रयोग करना है। तो हमारा आचार्य तो इतना जबरदस्त कह गया है हर चीज को, और हम लोगों के हिंदुस्तान के अंदर उसका हम लोगों ने फॉलो भी किया था, अब धीरे धीरे कम होता जा रहा है। अब अपने बात होती है कि एनर्जी को कम करने के लिए कार्बोहाइड्रेट क्यों नहीं दे दिया, नींबू का शरबत दे देते। डिलीवरी के बाद में थकान होती है महिला को तो कार्बोहाइड्रेट देते हैं, तुरंत एनर्जी देती है, तुरंत एनर्जी देती है तो कार्बोहाइड्रेट देते हैं। नहीं, आचार्य कार्बोहाइड्रेट देने के लिए नहीं कहता है, इसलिए के लिए कह रहा है कार्बोहाइड्रेट देते हैं तो साइटोकाइनेज बनता है जो इन्फ्लेमेशन का कारण बनता है, इसलिए उन्होंने मना किया। इसी तरह से अम्ल पदार्थों के लिए मना किया। इतना जबरदस्त कही गई है कि पहले जो ये वायु देनी है वो अलवड़ा देनी है, लवण के बिना देनी है, सोडियम नहीं देना। उसमें सोडियम भी वाटर कंटेंट्स को रोकता है, इन्फ्लेमेशन का कारण बनता है, जो इन्फेक्शन का कारण बनता है। उसके बाद में 3 दिन के बाद में जब अपने को ये वायु देनी है तो लवण देनी है। तो आचार्य तो इतनी जबरदस्त बात है कह गया। मैं तो सोचता हूँ कितना जबरदस्त बात आचार्य ने कहाँ से लिखा। इसी तरह से बहुत सारी चीजें हैं, उसका इन्वॉल्यूशन हो रहा है यूट्रस का, तो कितना आप अभी जैसे बात हुई व्यायाम मैथुनम कोपम शीत सेवा व्यवर्जित। व्यायाम, तो अभी व्यायाम की बात करें तो व्यायाम करना चाहिए। जी हाँ, व्यायाम कौन सा करना चाहिए, व्यायाम के लिए तो मना कर दिया, वायु प्रकोपित हो जाएगा। तो व्यायाम कौन सा करना है, जो मसल्स को रिटोन करना है, वहां के लिए दंड बैठक नहीं करनी है। रिटोन का मतलब है पेल्विक फ्लोर का मसल का एक्सरसाइज करनी है, रेक्टस एब्डोमिनस मसल्स हैं, अपने एब्डोमिनल फेसिया है उसकी एक्सरसाइज करनी है। तो ये एक्सरसाइज ऐसी करनी है जो कि मतलब वायु का प्रकोप न करे, वायु का अनुलोमन करे, इस तरह की एक्सरसाइज करनी है, वृक्ष की एक्सरसाइज नहीं करनी है। इसके कॉम्प्लिकेशन बाद के बहुत सारे होते हैं, बैकएक होता है, कॉम्प्लिकेशन अपने यूरिन रुक जाता है। तो ये जो कॉम्प्लिकेशन है उनकी अलग से चिकित्सा की जा सकती है, आचार्य ने हर जगह लिख दी है क्या क्या चिकित्सा की जाए। तो मुझे लगता है बहुत अच्छी चर्चा रही, इसमें बहुत अच्छी बात हो सकती है और की जा सकती है। मॉडर्न साइंस को देखती है, मॉडर्न साइंस तो बहुत हमारे बहुत पीछे है, अगर सही तरह से सभी आचार्यों को अध्ययन किया जाए तो। ये आचार्य सूतिकाचार्य में ये तो कहा ही नहीं गया, हमारे यहाँ तो कहा गया सूतिकाचार्य के बाद में सूतिका काल के सूतिकागार में नित्य प्रति गायन वादन होते रहना चाहिए। हमारे गांवों के अंदर अभी भी पुराने समय में जब बच्चा पैदा हो जाता था, सूतिका के दर्द को भुलाने के लिए और स्तन्य वर्धन के लिए जनने गाए जाते थे। बूढ़ी बूढ़ी औरतें आ जाती थी और जनने के गाए बधाए बधाए और जनने गाए जाते थे। तो वो भी एक अपने पेन किलर का काम करता है सूतिका के लिए, और स्तन्य जनन का काम करता है। तो अपने वात्सल्य में स्तन्य जनानाम, जब अपने पेन को खत्म हो जाएगा। इसी तरह से आज के समय में जब सीजरियन सेक्शन हो रहा है तो उसकी सूतिकाचार्य अलग होगी, उसके अंदर इन्वोल्यूशन देर से होगा, उसकी टाइम ज्यादा हो सकता है। आचार्य काश्यप ने 64 सूतिका के रोग लिखे हैं, उसमें भी योनि छत भी लिखा हुआ है, योनि भ्रंश भी लिखा हुआ है। अगर सही तरह से सूतिका काल का और ड्यूरिंग प्रसव, ड्यूरिंग अपने लेबर अगर सही तरह से अपने आचार्यों के अनुसार चलेंगे तो 64 रोग नहीं होंगे और हमको ज्यादा प्रॉब्लम नहीं होगी, सूतिका को भी प्रॉब्लम होगी। आपने मुझे बोलने के लिए समय दिया, उसके लिए बहुत बहुत धन्यवाद। फिर से योनि को शोधन करने के लिए, गर्भाशय को शोधन करने के लिए चाहे 10 मूल ले लें, चाहे एरंड मूल ले लें, चाहे कार्पास मूल ले लें, चाहे अपने पंचकोल ले लें, चाहे त्रिकटू ले लें, सारे के सारे शुरुआत में गर्भाशय को शोधन वाले मेडिसिन दी जाएंगी। और जो शोथ नहीं करते हों, एंटी इन्फ्लेमेटरी, जो साइटोकाइनेज को नहीं बढ़ाती हो, ऐसी मेडिसिन का प्रयोग किया जाएगा, क्योंकि वो व्रणीय है, उसका यूट्रस पूरी तरह से व्रण के रूप युक्त है। और जो अभी जस्ट बात की थी मैम ने, 3 महीने क्यों सर्वाइकल इरोजन हो जाता है, हाइपर अपने उसके प्लेजिया की वजह से, वो धीरे धीरे करके 6 महीने तक खत्म होता है। तो अगर 6 महीने तक खत्म होता है तो उसकी वजह से भी 6 महीने तक भी रख सकते हैं, 3 महीने तक भी रख सकते हैं। हार्मोनल चेंजेज है, लिगामेंट चेंजेज है, मस्कुलर चेंजेज है, एपिथेलियल चेंजेज है, हार्मोनल चेंजेज हैं, ये सारी चीजें हैं। इनके आधार पर हमारा जो टाइम बताया गया वो और प्लस मेडिसिन बताई गई है वो बहुत ही स्वीकार्य हैं और प्रैक्टिस में हैं। मगर आज धीरे धीरे कर मॉडर्न साइंस में आज के ज़माने में घी मना कर देते हैं, सॉरी घी नहीं है वो बटर ऑयल है। अगर घी है तो उसको एंजाइम रिएक्शन के द्वारा दही से बनाया हुआ घी होना चाहिए, उसी का प्रयोग करें। थैंक यू वेरी मच, धन्यवाद बहुत बहुत, आपने बोलने का समय दिया उसके लिए बहुत बहुत धन्यवाद
जी, थैंक यू सर, सो नाइस ऑफ यू। तो वी आर नाउ गोइंग टू कंक्लूड, आई थिंक टाइम हो चुका है। तो आप सबका बहुत बहुत धन्यवाद, एंड स्पेशली डॉक्टर ममता, स्पीकर ऑफ द डे, फॉर वेरी नाइस presentation, and thanks to all the participants join over here and all the experts whosoever shared their views. Thank you so much.
Thank you, Kamini ji and Mamta ji